Topic: Bitot sport. Definition: the Bitot sport engaging white sport, the overshaped and hermaphroditic appearance that appears in the conjunctive, the appearance that is associated by the nutrition deficit of vitamin A.
So a medical question I get a lot in the exam chair is, what's this yellow thing in my eye? I noticed this morning. I noticed this recently. I see this little, looks like a kind of a bump or a growth, and it's actually on the white part of the eye. That is known as a pinguiculum. And what that can be, or what it is a UV issue. So it's basically a growth. It's a fatty tissue deposit that's generally from UV, or sometimes being in a dusty environment, or growing up, spending a lot of time outdoors without sunglasses. More common in countries where there is higher UV, higher elevation. Basically, all the band of countries on the equator, those are extremely common. I do see them in the States. They are common more in Florida and sunny environments. And the big issue with them is pretty much they grow over time. So if you could wear sunglasses when you're a child, you really pretty much won't get those. So I always tell all the parents out there, make sure your child wears sunglasses. So what do we do about them? Well, generally, you really can't do much for them. If you don't wear sunglasses, or if your eyes continue to be irritated, that can grow, that can get larger. When it does that, it'll grow onto the cornea, and when it does that, it changes names. It's called a pterygium then, and those can be removed. Generally not really a great surgery to do, or we recommend to do, and generally don't recommend unless it visually affects your sight. So otherwise it's kind of an invasive surgery. But if it does have to get done, you can have excellent results from that as well. So the big picture is wear sunglasses now. And that also prevents other issues like cataracts, other UV related issues in the retina as well. So just make sure you're wearing sunglasses and keep it lubricated. That can help keep the redness down.
Pros and cons. Pros: improve your health and consume it for rich in vitamin A. Can help reduce the symptoms of bitter spot. Administration of topical antibiotics to prevent bacterial infection that may occur. Cons: if the bitter spot increases in size, a disease-caused xerostomia can develop, in which it improves like blindness, infection in the ear.
This picture represents what is called Bitot spots, and there are a few things which you need to know about Bitot spots. Basically, what is it? Why is it seen in liver disease, and how common it's an advanced stage of liver disease called cirrhosis. Now, Bitot spots is basically a triangular or oval gray or whitish plaque which is seen on the temporal or the nasal side, more frequently on the temporal side, as you can see in the picture. It occurs on the bulbar conjunctiva, and it is due to conjunctival cirrhosis, which happens as a consequence of vitamin A deficiency. Now, regarding the relation of Bitot spots with liver disease, it is believed to be due to malabsorption of vitamin A as a consequence of decreased fat content in the bile, and if present, it is a sign of liver cell failure. However, we see it rare in cirrhosis among adults irrespective of any etiology, and it is more frequently seen in children with advanced liver disease. You can see more videos on
Application in nursing. Complete with medical indication. Monitor urge resin to deficit post-hemorrhagic, monitor lead ache of venocles and permeability of the vein, provide psychological support to the parent and family, author a diet indicated by the doctor, perform cure and launch as it is indicated.
Well, friends, here have a look at the conjunctiva over the sclera. You can see a triangular area, which is actually the deposition of keratin in the conjunctival layer. So this is actually a known as Bitot spot. It can deposit in the form of triangular area or the oval area. This candidate came to us with the complaint of blindness during the nighttime as well as during the evening hours. So this Bitot spot usually takes place due to the deficiency of vitamin A.
Issue applied in Ecuador. In epidemiologic surgery and in clinical practice, ocular alteration of vitamin A deficiency or xerothalmy are the easy lesion to the text. In some practice of history, night blindness can be a simple rally disguise criterion.
Hey guys, in this video I want to talk about vitamin A, okay? There's some real interesting things about vitamin A. It's a fat-soluble vitamin. What does that mean? You have water-soluble vitamins and you have fat-soluble vitamins. Fat-soluble vitamins have the ability to travel through fat, to be stored in fat longer. It has the ability to go through cell walls because the layer around cells are fat lipid layers or fat layers. These vitamin A, fat-soluble vitamins can go right through the cell where water-soluble vitamins cannot. So they can affect the deep parts of the cell, the DNA, the alteration of the DNA, and that's why vitamin A deficiencies can really affect what your skin turns into, okay, at the genetic level. So you can have a lot of little flaking things on your skin, little white little dots on the skin, on the hair follicles. You can have little skin flakes on the scalp. You can have acne, different types of acne, cystic acne, acne on your back. It can create a lot of problems with your vision as well because vitamin A is necessary for your eye. So if you can't see at night, when you're driving at night and it's hard to see, that's a vitamin A deficiency, okay? Also, lubrication of the eye and the mouth. And anything, any glandular secretion, if you don't have enough of that lubrication, that's a vitamin A deficiency. Also infections, sinus infections, ear infections, lung infections, all can be triggered by a low vitamin A level. So it has a lot to do with your immune system. So vitamin A gives support to the eye, to the skin, to the immune system, to the inner skin too, around inside your nasal passages. So if you have, let's say, sleep apnea or anything that's going on with the inner skin of your throat, that could be a vitamin A deficiency, okay? Now, here's what people don't realize. Vitamin A is in cod liver oil, it's in liver, it's in butter, it's in eggs, especially the yolk. It's in cheese, okay? That's the active form of vitamin A called retinol. Now, it's true that kale, spinach, carrots, sweet potato, and greens also have vitamin A, and they have a lot of vitamin A. But here's what people don't realize. This is a pre-vitamin A. So anything vegetable has a pre-vitamin A. It's not an active form. It's not retinol. It has to be converted into an active form.
Conclusion. It is very important to consume foods with vitamin A that help with the growth and development of the human body, help the formation and the melting of teeth, bony tissue, mucous membrane, and skin, pro pigment in the retina of the earth, which will help you to prevent the pathology.
Well, friends, vitamin A deficiency is the common cause of preventable blindness in India. You can see the conjunctiva becomes dry, thick, and wrinkled. This condition is known as xerophthalmia. It ultimately leads to the corneal ulcerations. Even before that, the cornea becomes dry. And first of all, the epithelium of the cornea, it is broken down. Then vascularization takes place and then the corneal opacity develops. In the Bitot spots, you can see the keratin debris in the conjunctival layer, and they are the signs of conjunctival dryness. So, such children are more prone to the respiratory infections as squamous metaplasia of respiratory mucus that takes place. The signs are divided into the primary and the secondary, and the primary one includes, as I have explained, the X1A, which means the conjunctival xerosis. X1B is the Bitot spots. X2 is corneal xerosis. X3, A and B includes the corneal ulcerations. And the secondary signs are night blindness, fundal changes, the corneal scarring. The treatment, as soon as you diagnose it, and that depends on the age of the patient also. If